I'm Batman.
I am the Spider-Man.
I am Supergirl.
I'm Flash.
I am Wonder Woman.
Catwoman.
Welcome, superheroes, to my presentation of why everyone benefits from the national healthcare system. I truly believe in the need for a national healthcare system that takes care of its citizens and does not penalize those that cannot afford a healthcare program. I believe access to quality healthcare is a basic human right and not a privilege, and that the government should be taking care of its citizens. Your quality of life should not be judged by your paycheck. I want to start by telling you my first experience with the healthcare system and the people that worked there. It was about 17 years ago, and I went into the emergency room complaining of extreme dehydration, vomiting, nausea. I woke up 2 days later in ICU, where they informed me that I had diabetes, and I came within hours of going into a coma or possibly dying. When I was released into a regular room, a nurse came in, and I was crying because I had no idea what was going on. I didn't know what diabetes was at that time. My family, nobody had it. I didn't know anybody that had it. And every time somebody brought food into the room, I would start crying because I thought it would kill me. I explained this to the nurse, and she said, well, we see you don't have health insurance. We need the bed. I'm just here to make sure that you know how to give yourself an injection. And then I was shown the door. 3 days later, I was back in the emergency room. And I was consistently back in the emergency room throughout the year, because nobody wanted to help me because I was poor. Nobody should ever be made to feel like that. The Case for Universal Healthcare is an article written by the American Medical Student Association, and it states that the United States is the only nation that does not have a universal healthcare plan, which is defined as the right to healthcare for all citizens. While other countries have declared that healthcare is a basic human right, the U.S. treats it as a privilege, and only those who can afford it can get it. People without healthcare often delay going to a doctor due to the high cost and the debt that they will incur. Many people could be spared suffering and expensive chronic illness if they only had access to preventative care. When an uninsured person cannot pay for their bills, it falls upon the insured population, the doctors, the hospitals, and the government. All these billions of dollars of uncompensated health care drive up health insurance premiums for everybody. And the irony of this is that all these billions of dollars spent and people are still not receiving the health care that they need. Unfortunately, at some point in our lifetime, we will all need medical attention. If you show up at the hospital conscious, you'll be asked to produce an insurance card. Whether or not you can produce this information will affect the type of care you receive, the length of care you will receive. If you are not able to pay, things such as preventative treatments, follow-up care, and certain medications will not be made available to you. And this, of course, increases your risk of return trips to the ER, which is also crippling financially to the system. Here are just a few numbers from one disease, diabetes. This is supposed to be billions. 176 billion for direct medical costs, 69 billion in reduced productivity from loss of work or life, 99 billion for the 62 million estimated to be uninsured. This is just one disease. Add up all other chronic illnesses, diseases, injuries, pretty much anything that can send you to the hospital, and these prices spiral out of control. I believe that the major opposition that I would face in this argument is who's going to pay for this? Who will pay for this? Not me. Well, we're already paying for it with our tax dollars. This isn't my problem. I already have health insurance. The cost of taking care of the uninsured drives up your private health insurance premiums anyways. The government is not responsible for providing us with health care. If it truly is a government for the people, it should be a priority for that government to ensure the health of its citizens. We're already paying the price, but the money isn't going towards the system. It's going towards perpetuating a cycle of healthcare inequality. To begin to propose some solutions to America's healthcare crisis, let's take a look at what works in some other countries. Lots of other countries, not us. All right, we have Norway, England, and Sweden. All done with tax revenue, taking care of all of their citizens. low caps, out-of-pocket costs. You go down to America, also funded by tax revenue, over $6,000 out of pocket for an individual, over $12,000 for a family. I don't know about you, but I don't have an extra $6 grand laying around. As you can see, all these countries, all three of these countries, finance it with tax revenue. The U.S. also funds Medicare and Medicaid with tax revenue. But about 20% of the non-elderly population goes without health insurance at any given time. We spend more on health care than any other nation. We spend more on health care for people 65 and over than any other country spends on its entire population. When health care is needed, too many Americans don't receive it. They receive it too late, or they receive poor quality. With a functioning national health care system in place, you could be provided with access to preventative care and regular doctor visits, and this could prevent you from becoming ill in the first place and would help the system financially. In a study released by the Milken Institute, the annual economic impact, technical difficulties, sorry. All right. To the U.S. economy is approximately $1 trillion. This is set to go up to approximately $6 trillion by the middle of the century. But this is not bad news, because most of this cost is preventable. With the national healthcare system, we could have access to regular doctor visits, preventative care, and stop a lot of these chronic illnesses before they even begin to take hold. Dealing with the constant stress of having to wonder if you can afford medical treatment is also bad for your overall well-being. With the stress of worrying about whether or not you can afford to go to a hospital or go to a doctor, you can be more confident in your life and in your health. Being healthy allows us to focus on the things that really matter to us in life, such as your family, your friends, traveling, financing a home, and basically saving all the money that you would be throwing away on a healthcare system that doesn't work. I do have one step we can take. U.S. Representative Kathy Castor, the 14th District of Florida. She rallied for Obamacare to come to Florida. You can email her at this link and let her know it's not okay to fine people for being poor. What happens when they run out of your income tax to garnish? They'll come after your paycheck. You're taking money from people that don't have money to begin with. It is an unfair system, it is a broken system, and we are an unhealthy nation. I hope you can take a minute to let her know how you feel. Thank you very much.